Okay, here we go, Miss Rose. Can you tell me, it's been 2 years since we've been working on your problems, and go over the list of problems that we've been working on and the major one.
I've had RSD for close to 20 years, and I had been from doctor to doctor. I've had 3 doctors diagnosed me that have diagnosed me with RSD, and I have been going to a neurologist for the past close to 20 years, and my condition, my RSD condition, had been getting worse, and the reason I came to see Dr. Dr. Rodriguez, I call him Dr. Rod, is because I have some friends that have similar problems, and they had talked very highly about Dr. Rod, and I finally gave in. I was almost in a wheelchair, and in fact I had been shopping for a wheelchair because I could not walk anymore. My condition was getting worse. My hands were curling in, my feet were curling in, and my condition was just getting worse as far as my pain and my medical condition. And I started to come see Dr. Arad, and when you have RSD, nobody can touch you. Your condition is so bad that even the slightest touch hurts immensely. And but I was willing to give Dr. Rod the ability to work on my condition because of the fact that I felt that if I didn't allow that to happen, that I would get worse, and I would be in a wheelchair and in bed most of the time, and I'm not that type of person. I have to be moving, and I have to say that I have regained, I'm going to say 75 to 80%
That's
of my,
okay.
yes.
Okay.
I used to take sleeping pills at night to sleep, and I have gotten off my sleeping pills. I was taking between 6 and 8 medications a day, and I have gone down to about 3. And sometimes I get really bad, I have to say, I have to admit, especially when the weather changes. But it is not as bad as it was before.
Okay.
And
That's fantastic. Now, you remember me talking about the UK group of the complex regional pain syndrome,
correct.
and they were calling all my research and my therapy preposterous. Do you have anything to say to them?
I have to say that when you have RSD and you have a condition that you're willing to try anything, and I know for a fact that you get to the point that, because there's so many quacks out there, I had gone to about 3 acupuncturists, and that's the reason I was kind of hesitant to come to see you. But the thing is that I was willing to continue my search to have someone find something to help me out, because I was not willing to take it lying down.
Mm-hmm. Mm-hmm.
So, and I do not believe it's preposterous, because I am...
You're the result of it.
Yes,
Yeah.
I'm able to walk. Sometimes I have a little bit of a problem, but at least, for the last 2 years, like I said, I was wheelchair bound, and I was willing to try this, and I am able to walk, and that's and I am able to hold things. I was
Okay.
dropping things.
Okay.
I'm able to hold things. I'm able to, that people are able to touch me a little bit more because
Yeah,
I wasn't able to.
Okay.
So
So would you recommend this to other people?
if they can find a doctor like Dr. Rod, I would say yes.
Okay. And thank you very much.
I appreciate it.
Okay.